Hello, my name is Pamela Proverbs, and I am representing Group 5 team members Mary Panks Holmes, Mark Young, and Derek Vanderbilt Nicholson. Given the perennial reputational and crisis risks that plague the pharmaceutical industry, CSR has become the linchpin that allows companies in this industry to stay in business. We've chosen to explore the GSK Pulse initiative because it stands up to a number of the tests on which some CSR initiatives are built. It is aligned to GSK's business objectives. It benefits a wide stakeholder base from employees and communities in which it serves as far as the developing countries who are in greatest need of its products. Pulse's overall strategy has been found to be sustainable. Let's explore. GSK is a global healthcare company located in London that researches and develops products in pharmaceutical, vaccines, and consumer healthcare. GSK's mission of helping people do more, feel better, and live longer is supported by 3 strategic priorities that include growing a diversified global business, delivering more products of value, and simplifying the operating model. The GSK mission explains the company's reason for existence, but to achieve the mission, GSK underpins its strategic priorities with a responsible business approach that is driven by values and effective governance. Let's look at the situation that exists on the competitive landscape. GSK is part of a very competitive industry. To build capacities and to get hold of drugs that are at the end of the research and development cycle, most companies engage in mergers and acquisitions. From a competitive perspective, GSK is considered a leader in this industry and is currently the world's 6th largest pharmaceutical company behind other multinationals such as Pfizer and Merck. It is inherent to the core business strategy for pharmaceutical companies to invest in corporate responsibility initiatives focused on improving access to health and addressing global health issues. What some of their competitors are doing. Merck has implemented giving programs, volunteerism, and community engagement in locations where they operate. Pfizer has the US Patient Assistance Program, medicine safety education, and energy and climate change programs. Abbott Laboratories has the Abbott Fund, a philanthropic foundation established in 1951. The Abbott Fund mission is to create healthier global communities by investing in creative ideas that promote science, expand access to healthcare, and strengthen communities worldwide. Pharmaceutical companies need CSR, and even more so than some companies because they face a lot of issues on a daily basis in relation to abuse of their power, since they're some of the most powerful companies in the entire world, in terms of inadequate publication of the clinical trial data, in terms of hiding or minimizing of drug side effects, and of course, recently there have been a number of scandals with regards to payment to physicians. Let's do an overview of GSK's CSR. GSK takes 5 overarching focus areas as its core in terms of the CSR approach. 1. Creating value for societies. 2. Responsible business priorities. 3. Governance. 4. Values and conduct. And 5. Listening to stakeholders. Its business case. In terms of business case, GSK's commercial success depends on creating innovative new products and making them accessible to as many people who need them as possible. This approach would advance GSK's mission, position the company to meet the global challenges, goals, and stakeholder needs associated with both the vaccine business and the Pulse program. It's our view that there is an opportunity for GSK to build on the Pulse Volunteer Partnership Initiative as a leadership platform platform specifically targeting the vaccine business. In terms of stakeholders, there's the local communities, nonprofit organizations, business and community leaders, volunteers, academia, the media and customers, the medical community, global health and international development agencies, employees and shareholders, and governments. So what is the Pulse initiative? Pulse was launched in 2009. It is a skills-based volunteering initiative that matches eligible employees with a nonprofit organization for 3 or 6 months full-time. The initiative enables employees to contribute their own skills to solve healthcare problems in their own communities and around the world. The initiative has a threefold mission: to change communities, change employees, and of course, change the company for the better. In terms of measurement, measuring progress and reporting it through Pulse Volunteer Partnership Impact Report is an effective tool that GSK has been using for a number of years. Pulse delivers benefits to stakeholders directly involved in the initiative. It provides employees with experience and sustainable benefits to the recipients of the programs and the communities in which they live. Pulse also provides educational opportunities for the partners involved. In terms of the numbers, in terms of impacting in the community, impact on communities, according to the Pulse report in 2014, GSK had nearly 100 employees working on long-term assignments with 38 nonprofit partners in 33 countries. The impact on employees: 98% of Pulse volunteers believe that their assignment helped them develop their leadership skills. And in terms of direct impact on the company, Pulse volunteers were exactly twice as likely to advance their careers through a move, transfer, or secondment following their assignment. We would like to review some recommendations for your consideration that would improve and enhance GSK's overall CSR strategy and reputation by further leveraging the Pulse initiative. The Pulse initiative is already closely tied to GSK's 3 strategic priorities that include growing a diversified global business, delivering more products of value, and simplifying the operating model. Pulse has been embraced by our employees and is now part of the corporate culture. In terms of the business goals and the issues, although Pulse has yielded major benefits to employees and the communities it serves, its existence is not featured prominently online, and we are guessing that this is the case in the communities it serves as well. A large part of engaging in CSR is allowing your constituents to know of the good work you're doing. We therefore see a need to revisit the objectives of this initiative from a communications perspective, since we found that this is meeting employee and organizational needs, but is lacking in visibility. There's a number of opportunities in terms of the Pulse mission and growing the business. In terms of the change to the community, R&D streamlined process, strategic planning, increasing staff capacity are all ways we can change the community in terms of the business. In terms of the change employees, the leadership, resilience, learning, communication, and cultural competencies, and of course, in changing GSK, there's the employee development aspect, advancement of movement in order to meet the demands of the growing vaccine business. We would add one more objective to the Pulse mission, and that is to stimulate enhanced awareness of the good work GSK is doing for employees, NGOs, and developing communities, both online and in the communities it serves. There is opportunity because GSK develops, produces, and distributes over 2 million vaccines every day to people across 170 countries. There is tremendous opportunity to expand the Pulse program from 33 countries to more countries, to build more partnerships, reach more communities, and advance the mission. And of course, there is opportunity for more partnership with countries, development agencies, and communities. Some of the key message and themes based on stakeholders for partners in NGO, governments, etc. GSK is people-centric. It's a people-centric organization which invests its resources to better the communities in which it does business. In terms of the public and media, etc., GSK is expanding its mission to help people do more, feel better, and live longer by expanding the company's Pulse Volunteer Partnership, a skills-based volunteering initiative. The values that support the Pulse mission include putting the interests of patients and consumers first, create public value by improving access to health care, respect for people, integrity, transparency, delivering more products of value, simplifying the operating model, and conducting responsible business. The existing tactics. GSK has employed 2 specific tactics that we recommend using as a foundation for the Pulse initiative. Pillar, expand the Pulse Pillar project to more organizations like the Direct Relief Partnership, improving procedures to get vaccines and medicines to people in need, and the Innovative Challenge, which capitalize on insights that the Pulse volunteers bring back with them, ideas that benefit the business as well as society. The new tactics. GSK treats Pulse as an internal program for employees only, but the program touches so many more people, organizations, and countries that this should be leveraged through Pulse visibility, which includes a social media strategy with dedicated Pulse blog, dedicated Facebook and YouTube pages, Pulse on Instagram. This will allow for greater participation by stakeholders, which build greater credibility for the value GSK says the program has. In terms of our schedule, we propose the following action plan with a strategic communication plan, internal stakeholder engagement, external stakeholder engagement, research, a CSR strategy that expands the Pulse initiative, contingency planning, CRS initiative focused on the communication strategy, and of course, measurement and evaluation. In terms of the schedule, in 1 to 3 months, we perform some secondary research. 4 to 6 months, primary research and define how we can improve the program. 7 to 10 months is the implementation and action plan. We will closely monitor, and of course, 11 months to a year, we will analyze the outcomes, outputs, and outtakes to determine what to change moving forward. Measuring progress and evaluation. There's a number. Progress will be measured through Pulse program initiative matrix, and vaccine business and stakeholders need to capture the overall success of the program, including a number of measures: accelerated research and development of vaccines, quality and manufacturing, education and communities where vaccines are being given, sales performance of the vaccine business, increased number of partnership and collaboration towards a common goal are just some of the measures. And that's it. We thank you very much for listening.